Sunflower Electric Power Corporation, cooperative members working together to generate power so you can enjoy the benefits of life in central and western Kansas. Sunflower Electric Power Corporation, energy done right.
Good evening and welcome to the Kansas Legislature, our Friday evening talk show dealing with politics and proceedings of the Kansas Legislature here on Smoky Hills Public Television. I'm your host, Jay Steinmetz, Assistant Professor of Political Science at Fort Hays State University. We've got another excellent show lined up for you this evening. I have here two representatives of the Kansas House of Representatives. First, on my left, Representative Susan Concanon of the 107th District, that covers Beloit. And we have here Representative Christina Haswood of the 10th District, covering southern part of Lawrence and Baldwin City, correct?
Mm-hmm. Yes.
Great, welcome. Good evening, and great to have both of you here. Let's begin talking about the pandemic. It feels like we're coming out of this pandemic, and I know everybody wants to. It feels like the finish line is getting closer. Vaccines are readily available for everyone 16 and older, but vaccination rates have slowed. Demand has slowed. It was recently in the news that several counties in Kansas had refused further shipments because they don't have the demand. And there's some concern here that Kansas is at about 49 or 50% fully vaccinated amongst adults, which puts Kansas kind of right in the middle of the 50 states in the United States, not enough to reach herd immunity. And the concern here is, how do we encourage that next group of people who might be concerned or skeptical, maybe getting some misinformation or disinformation about the safety of this vaccine? How do we encourage those folks to get vaccinated? And what role does the legislature play in that? Let's start with you, Representative Concanon.
Well, I don't really feel like we have a role as legislatively as far as any laws, but as leaders in our community to encourage with information and to try to share what the facts are. And I feel like if they're already not trusting it, I don't know that we can do anything at this point other than to just be leaders and say how we feel about it.
Yeah, it's a tough problem.
Let people know that we have had the shot.
Certainly, yeah. It's a difficult problem because I'm not sure it's politically feasible in this country to do something like mandatory vaccination.
No.
So there's not much of a role that the legislature can play in passing law. But you're right, Representative Concanon. Representatives, elected officials, as leaders in their community, can share their stories, can assure folks that vaccinations are safe and are available and are effective. Thoughts on that, Representative Haswood? What more can we do to encourage the community and that we can reach herd immunity?
Yeah, I look at my community too in District 10, and I work part-time at our COVID call center, so I've seen these numbers. When we started with the vaccine rollout, we had about 500, 600 calls a day, and those are slowly decreasing. One of the barriers I see is, here in Douglas County, we only have vaccines from 2 to 6 p.m., and the schedule before that, I believe, was maybe in the morning. So it really missed the working classes hours from 9 to 6 p.m., and, availability for the weekend really wasn't there. I think there's still some barriers. Maybe we can get people who are still wanting to get the vaccine. But, I believe our county public health are doing such a great job. They're really trying to stay on top of it. But for the Kansans who maybe are vaccine hesitant, thinking about me as a person of color, there are histories of medical misuse and ethics that I understand, because even myself, I was vaccine hesitant. When I got the call, I got mine through Indian Health Services. When I got the call, I was just like, I don't know, but I thought about it, and I talked to my family about it, and you're like, this is really going to help our community. I'm Navajo Nation too. I'm Navajo. We got hit really hard across the country. I lost a couple family members, and it just really impacted our community. So it was really, it took it really personal. So I really gave it some thought and really looked at the perspective of, I'm not only going to be vaccinated for myself, but I'm going to be able to go out in the community. We're able to knock doors next election cycle and meet people. We'll be able to get back into going to Walmart normally and grocery store shopping. So somewhat of normal, I think. Really to put that message out to Kansans that, this really is not how, I don't think anyone's happy right now with mask mandates, with hours cut. So if we really just say, hey, if we want to get back to our new sense of normal, we have to come together and do this for not only ourselves, but for our community.
Yeah, those are great points. And, historically underrepresented people, persons of color, there's history there and skepticism in this country and elsewhere. I was reading a report about United Kingdom and how to encourage Black Britons and UK folks from Southeast Asia. It takes an information campaign, and maybe that is a role that the legislature can play in terms of providing a campaign, an information-based campaign, to get information out there and to communicate directly with the public. We have an early caller here. Wynn from Andover is on line 1. Good evening, Wynn. What is your question?
I am wondering why we would be attempting to limit voting in the state of Kansas through legislation, and as opposed to allowing us to do mail-in, that kind of stuff, which I understand is a national trend. But I would hope that we would try to open up voting in the state as opposed to try to shutting it down. And with that, I'll listen.
Thank you. Great question. There is a bill in the legislature, has not passed, that would restrict mail-in voting to close that 3-day window or that 4-day window when you can postmark a ballot on election day and let it wind through the USPS. There's been some concern over that, that it's not really necessary. I've had legislators on the show say Kansas did a great job in the election, no real problems. Familiar with that bill, Representative Concanon? Support or not support for?
I'm a little bit familiar with it. I don't serve on that committee, but I think we did do a great job in the last election. I'm friends with former Representative and now Secretary of State Scott Schwab, who has assured me that the election was safe and we can trust the results. With that said, I think that if we do shorten that window, it's just a matter of information, of getting the information out so that people do know when that deadline is. And I would not oppose it simply because I feel like we have a perception problem. I think that people in the United States believe that they're, not everyone, but there's a large percentage of people, and including Kansans, who believe that there were problems in the last election. And if there are things that we can do to calm those fears and to help them trust the elections to be safe, then I'm willing to support it.
So it sounds like optics here, that you can that passing some legislation could maybe alleviate some of those concerns and change the perception of voting integrity and elections.
Absolutely, as long as it's not, as the caller was saying, as long as it's not taking away somebody's right to vote or limiting their right to vote.
Sure, and that is a legitimate concern. I mean, there are some studies suggested that if this law were to pass and information were not out there, that it would affect some 30,000. There were about 30,000 Kansas voters that mail-in voted and postmarked on election day. Concerns about this bill, would this be something that you would support, Representative Haswood? What would be the rationale behind a support for this bill or not supporting the bill?
So I know the governor just vetoed 2 election bills that would restrict a lot of voting accessibilities. My main concerns that we see on the floor that does, have some voter suppression towards it is that I understand, and I get it from my community as well, from District 10, where we have concerns of our elections and making sure that their ballot gets there. And I hear from my constituents too that they really want to ensure that we have a secure election. I appreciate the concern, but I think, looking at our county elections official officer, they do a fantastic job. The office does a fantastic job, and I applaud them because even they try to meet this, out of the working hours and adding ballot boxes. And, I remember in the primary there wasn't a ballot box in Baldwin City, which is a little bit rural south of Lawrence, and, we expressed some concerns and they put a ballot box there for the general. In the legislature, especially with some of the bills, I feel like we try to they try to address issues that we hear concerns about from the legislature on a daily basis of our elections. But maybe the issue only scratches to a level where it unintentionally impacts like our college students, our elderly population, people who really need that permanent mail-in ballot system. Maybe they can't get to the polls. Again, our working class who can't get time off of work. My father works a factory job, and his second, third shift that gets scheduled throughout different years. I really feel for those individuals and those Kansans where maybe we don't have a job where we can just take time off and have the accessibility for. I think those are some issues that maybe we can come together on to make voting accessible. But I really believe that our county election officials are doing a great and fantastic job. Or in Douglas County, I can say.
Yeah, it takes trust in the system, and it takes trust in the broader national election system as well. Voting rights and voting access. How important, Representative Concannon, how important is it to you that we have high voter turnout in this country and that we have as many eligible voters who have the choice to be part of the political process?
Well, that should be everyone's ultimate goal. Yeah, the more people that we can have involved in the process, the more representation that we have, yeah.
To Representative Concannon's point, Representative Haswood, the issue of perception and the concern about this, there is very little evidence to suggest any real problem with fraud or corruption in our voting system, and there's zero evidence to suggest any widespread fraud in the last election, November 2020. We had over 60 court cases summarily rejected. We don't have any evidence at all, but we have a perception problem. How are we able to, is this another point at which information is important, elected officials speaking to their communities about trust and integrity in the system, and not just Douglas County or Ellis County or the county where Beloit is, Mitchell County, but nationwide, trust in the system. There is good evidence to suggest we have a very strong, transparent, and effective voting system across the states, partly because it's decentralized. Thoughts on that? How do we reach out to the public on that one?
I think we have a lot of relationship building to do because from the federal level, there was a lot of, I feel like, negative narratives to elections, and unfortunately happened with January 6th at the Capitol in Washington, D.C. We can see how serious, when you put that negative, narrative on something of our elections, it really rallies up something negative that will happen. So I think we see where if we continue with this down the road, it could lead up to something extremely terrible. But if we have the chance now to fix it and really share the facts and share, work with our communities without, working with our election county officers, maybe there's something that can be improved in the community, and working with our elections committee, I don't serve on that committee as well, so I think, reaching out to that committee and sharing your concerns with them would really help build trust into this. And, I think that's the whole thing about politics too, is people sharing their concerns and their issues, and for their representatives to give them a call back or an email back and say, hey, I hear you. And I will make sure someone on the election committees hears that issue, because we don't have any committees together, but sometimes I'll catch you on the floor and be like, hi, my name is Representative Haswood, and what do you, maybe we can talk about issues there. There's always maybe 5 minutes to chat. So I think, we can all play a part in the system of building back trust.
Additional thoughts here?
Yeah, I would just say social media is a real issue with this, and instead of it being a negative source of information, maybe we can figure out a way to make it a positive source of information, and But I have not figured out exactly how to do that yet.
If you did, you'd probably be paid a lot of money and have an important job.
Yeah.
It's a difficult issue, right?
is.
And it takes private initiative, and it takes information. It takes the public as well making better choices. Here's a good segue. The Civics Education Requirement Bill that passed the legislature was vetoed by Governor Kelly. This Civics Education Requirement Bill would require high school students in Kansas to pass a 60-question multiple choice civics exam taken straight from the citizenship test in order to graduate high school. I think the requirement would go into effect in something like 2021. Governor Kelly vetoed it. Did you support this civics exam requirement, Representative Concanon? And if so, what was the rationale behind that?
No, I voted against that bill. Of course, we want our students to be able to answer those questions I'd like for all the legislature to be able to answer those questions as well. But those kind of decisions are made by the local school boards, and it should be left for the State Board of Education and the local school boards to create the curriculum. I think we would be heading down the wrong path if we start designating what students should and shouldn't learn in school.
So a local option issue here in this respect. We heard that on the last show with Representative Stephen Johnson as well, saying voting no because of the local option issue. Representative Haswood, your thoughts on the civics requirement? Did you vote for it, and what was your reasoning behind your vote?
I voted no, and I echo the same as Representative Concanon that we elect our school board to carry out the curriculum of the needs of our community. Another interesting thought I'm going to put out there that I visited with some KU students about a month ago, and one of them asked me if this is coming from the citizens test, would those that are undocumented be getting citizenship? So why are we using a curriculum if we're not even following that same process? It was a really interesting point. I wish I would have asked the carrier of the bill about that. Why not knock two birds with one stone? But I also think that we do want people to understand civics because sometimes we have people who email all 100-something of us on emails for one issue, and just the basics of finding who your state representative and your state senator. I understand it's a confusing task. I believe, even down to committees and how to testify is such a confusing process. If we can make that easier for somebody, that'd be great. But a civics test to graduate high school, it also brings the point, okay, if we're going to put something that's required for high school, what's being taken out? That was one of the real points that really stuck with me. Okay, are we going to take out math? Are we going to take out social studies, or which part of the main curriculum are we going to have to take out for students to graduate with? That's my biggest concern. So we'll see.
So the other side of the coin here on this one, I mean, some talk that they're already teaching civics in public schools, but this is not an unusual bill. There are 19 states in the United States that have implemented some form of a civics exam requirement, and the oldest state, Massachusetts, has developed a qualitative, it's not just multiple choice questions, or sort of, volunteer internship components associated with it. Not an uncommon bill, and I ran my own numbers here, and the mean score on the U.S. government AP exam by state, there's a pretty positive correlation between that mean score being high and a civics exam requirement. Is this something that might be considered down the road as a possible implementation? The rationale here is that civics exam requirement is well suited toward a top-down comprehensive approach at the statewide level. Thoughts on that, Representative?
Well, I think
Concanon?
that's really important information, and it would be important to share with our State Board of Education. I still, philosophically, I do not believe that falls on the legislature. I just add one more interesting part about that bill is that it was amended, I believe, in the Senate to add financial literacy to it. So it's both civics and financial literacy, which are both very important, and I believe they both should be taught in school, but that is a direction that should be given by the State Board of Education.
Thoughts on that, Representative Haswood? 19 states have implemented something like this, maybe looking at that down the road?
When you said AP Civics, I was not even, that wasn't my educational ability in high school. So looking at, I don't feel included into that statistic already. And I imagine many of you high schoolers out there, we're just in the normal civics course that we take in senior level of high school. So when I think of that, I really feel that we should leave it up to the school boards and, let them, do what we elected them there for.
Yeah. Let's move to another issue, an important one, an emotional issue on the floor. This is the Kansas Legislature had passed a bill that bans transgender athletes from participating in women's sports at the K through 12 and higher education level. Passed the Senate 26-11, passed the House 76-32. Neither of those are veto-proof majorities. Governor Kelly called the bill a job killer. There was some question as to whether or not she would sign it. Ultimately vetoed it. Thoughts on the bill? Did you have support for that, Representative Concanon? And do you think that there is going to be a veto override attempt on that one?
Well, I'll answer the second question first. I do think that there would be an attempt to have an override. I've heard from a lot of constituents who in my area would like for me to vote for the bill. I voted against it the first time. But I'll tell you that whenever I look at a bill, I ask myself, is it constitutional? Does it solve a problem? Can the state afford to do this? And to every one of those questions, the answer was no. The way that the bill is written, this opens us up to a lot of litigation. I just think that it will end up costing the state millions of dollars, if not billions of dollars, in lawsuits. The universities opposed it, the business community opposes it, mostly because it would be a difficult bill to defend in court. There's terminology used in the bill that are more geared towards business, that don't translate into sports, such as the word retaliation. In business means one thing. In sports, it could be a parent who believes that a coach has retaliated against their child. The bill also opens up the opportunity for another team to question your gender, and that opens to lawsuits of if someone's played that shouldn't have been, or if someone gets pulled, then they can sue the school because they shouldn't have been pulled. I mean, there's just a whole host of problems. Plus, I don't think it answers the constitutionality question. I think that we'd be fighting an uphill battle with that. I had one more thought.
The second point you made, which is that does it solve a problem?
Does it solve a problem?
That's an interesting one as well, because I mean, there's a lot of there's been discussion that there is not a problem here. This is a fabricated problem in some ways, or a theoretical one in theory, but not in practice.
Well, it's being brought from other states. It's a bill that was brought from other states. We've been told that there are 5 student athletes that are transgender in the state because of privacy. They don't release who they are, but no one has complained. There's not been a complaint. There's not been a single school board who has asked for help on this issue. There's not been a single school board who has come before the committee and asked for the bill to be passed. So it's not, in my mind, it's not solving an issue that's happening right now. In my mind, if this does become a problem, I think that we would be much better served as a state to hit the pause button and wait and see what happens in other states as far as Title IX and some of the other lawsuits that are already out there. Let that get figured out, and instead of us, having our own lawsuits going on in Kansas. If that needs to be taken care of, we still have time to do that.
Yeah, and it sounds like not solving a problem that exists, but it could create a whole host of problems. Yeah. And one of the problems that I think you touched upon, Governor Kelly had mentioned this as well, We're targeting, in this bill potentially targets children who are already at a high risk of bullying and discrimination and suicide rates. That seems to be a concern here as well. Thoughts on this bill and the potential for a veto override in the legislature, Representative Haswood?
This bill really upsets me. Making a bill against trans athletes and women for a population that already feels not accepted in our society, for a population, there's no evidence that they're disrupting our athletics. It's really angers me a lot of times too, because, they have the highest suicide rates in mental health, and this is a bill that's really telling our trans youth and our trans community that we're going to discriminate you, and you're not welcome in here, and there's no facts to it. And I tell people this is a hateful bill, and they're like, oh, I don't hate people, but okay, this is discrimination then, because you're singling out one small population and saying that they can't do this where there's no evidence that they're disrupting it. And then I think about one of the things that really rubs me the wrong way is this narrative that girls need saving. Girls are dainty and damsels in distress, and they need to be saved of their sports. I talked to this with my colleague, Representative Vaughn. We both graduated high school 2012, and we both played sports throughout our high school, middle school education. And, this really wasn't an issue. We always play sports with LGBTQ plus youth. And, this was something that we're questioning, why is this needed? We don't hear from our constituents or from women's athletes. And then looking into the bill, it includes intramural sports in college. And, in college, not to toot my own horn, but I was on intramural sports where we went to the championship. And I just thought about, you really don't know how much this bill spreads down to the intramural sports? Are we serious? And, we have, if we want to go to the economic side, NCAA already has their, policies in place to have trans athletes feel like they're accepted into the correct sport that they wish to be in for all trans folks. So, this bill really angers me. I'm so glad that we have Representative Byers to be the voice that hasn't been there in the State House, where this will probably continue to come up again. But I really hope that we come together and really try to build a better and just society where these people don't feel like these of our Kansans, all our Kansans, and all women and all girls will come together and not feel this discrimination, because they belong here. They're beautiful. They have a place in our society. And we really shouldn't be saying that you don't belong here. It really, really angers me.
The 2022 GOP gubernatorial candidate, Jeff Collier, former governor as well, quote here, Laura Kelly's shameful veto of the Fairness in Women's Sports Act cannot stand. Our girls deserve the opportunity to compete on a level playing field. I call on the legislature to override the governor's veto. Question to you directly. Do you think an override is going to be attempted? And how successful do you think it's going to be?
I believe, those who don't believe in having, in support of this bill will want to override the veto. And, us that support, the trans community, we will fight for the trans youth and for the trans folks in Kansas. We've seen other states have sustained the veto, and we've seen other states around us, like Missouri, I believe it passed anyways. I really have faith in Kansans and, my colleagues in the State House that we can choose to bring, equity and equality to our state, because we have such a dark history with LGBTQ plus community in Kansas, and even in our Constitution. I really hope that Kansas does not, stay on this path, because it's also not having our state being attractive for young folks, for even my future children or my future grandchildren. Who am I to guarantee that they're going to be cis male or cis female? I think this is a really dangerous policy that's not solving an issue, first of all, but also can be way harmful down the road.
Let's switch gears here and talk about mental health, especially rural mental health. Mental health issues have just been exacerbated during the pandemic by all measures and across the country. But in particular, folks in rural areas of our state have faced severe limitations with regards to access, quality of mental health resources. What is the solution here? How do we fix this? What steps can we take to put Kansas on a path toward even being a national leader when it comes to rural mental health in, say, 5 or 10 years? Representative Concanon, thoughts on that one?
Well, we were already kind of moving towards additional funding towards mental health, and especially in the rural areas, as you said. But with the start of the pandemic, there have been a few positive things that have happened, and one of the things that we have seen is how much we can use telehealth. And the fact that we have extended that for another year to be able to pay for telehealth in our local communities, and mental health is one of the areas that it has been very commonly used. The reason I mentioned before even the pandemic is that we had a bill a couple of years ago to help with encouraging psychiatry as a residency program and a specialty, and to bring them into the rural area. So we're trying to do that, bring more specialists in. We also have been making an effort to more regionalize mental health, rather than having the two main state mental hospitals with Osawatomie and Larned, and the state's kind of divided east and west as far as which catchment area you're in. But to create more of these smaller regional beds around the state, and in that way we are helping them get more immediate care, as well as not on those waiting lists where they're waiting in emergency rooms and jails in order to get a hospital admission.
Yeah, great answer. Thoughts on that, Representative Haswood? What can the legislature do specifically to improve quality and access of rural mental health, and how does Kansas become a leader in this one?
So I sit on Health and Human Services Committee, and this has really been one of the main topics that we really have had many discussions on. We have reports on, the Mental Health Task Force and their recommendations, and really seen a need. When I first started out in Health and Human Services Committee, we had a report from mental health, counselors, I believe, across elementary schools and high schoolers, and we heard success stories, and we heard stories that saved lives. And if we invest into these mental health services, that would be, life-changing. In the rural areas, I really respect my colleagues from the rural communities that advocate. Every time we have a mental health bill, it's like, how do we ensure that the funding will go to the mental health facilities in my district or near my district? So there has been some, discussion talking about, okay, when we have funding, it's going to definitely go to the top 3 rural counties. And, how do we continue to make sure that the rural mental health facilities are prioritized? Because I know some communities, such as my community, Douglas County, might be a little bit larger, but we definitely want to, when we have the funding, to make sure that we have the rural Kansans taken care of. I believe we also talked about telehealth as well. And that also ties into the issues of broadband, of how do we successfully do it, but also not make it too much of a norm where we take away in-person mental health visits, because those themselves are very extremely important, where you really want to see someone and say, okay, you look healthy, and you don't have bruises on yourself or self-harm. So I think that Kansans, we have a great group of folks in the House Health and Human Services Committee that genuinely care about mental health. And we even talked about, there was this one bill, I'm losing the bill number on it, but it was kind of like where the community puts in $1 and the state will put in $2 of funding. And it was this buy-in program. And it was really interesting, where you have the community invest in a service, but the state will also help. But maybe if we do Medicaid expansion, we could have federal buy-in as well. So it's really interesting to see these conversations and these innovative ideas that I get so excited about, where we can all pitch into mental health funding, and we can bring these services to the mental health areas of the rural areas as well. Also, I believe our rural structures and hospitals of mental health facilities really do need to be taken care of as well.
It feeds right into my next topic, Medicaid expansion. Although, before we do, just to remind you, this is a call-in show, and we appreciate your calls and questions about politics and policies of the Kansas Legislature. That number is 1-800-337-4788. This is a call-in show. You can call 1-800-337-4788. So Medicaid expansion, the old war horse that we talk about so often on the show. Support for Medicaid expansion, I believe, is a yes for you, Representative Kincannon, and a yes for you, Representative Haswood. So the question really is, how do we get this done? And where is the process right now in terms of Medicaid expansion? Representative Kincannon?
So I have I've worked on Medicaid expansion for several years, and the fact is I used to sit on Health and Human Services, and that's one of the reasons I no longer sit on Health and Human Services, because working on that issue, it costs some, there's a political cost to it. So I was removed from the committee that was my favorite committee, and I was the vice chair. But we all, I think that the audience and all of us understand the importance of that to the rural area, and why I would be one that would support it. Where it's at now is kind of in a stalemate because of the last election. We just don't have the votes anymore. Possibly we could put together a coalition that could support it on the House side, but there's no way that it passes the Senate. So it's difficult for us, especially the Republicans that support it, to take that leap and make those kind of votes when then it's used against us in the next election, or we pay a price for it from our leadership.
Kansas Speaks survey from the Docking Institute published in the fall 2020, 63.5% of respondents supported expanding Medicaid in Kansas. 64% of respondents agreed that Kansans who obtained health insurance for Medicaid expansion deserve this benefit. Estimates suggest around 165,000 Kansans who are currently uninsured could be insured by Medicaid expansion. That's a pretty solid majority in an otherwise polarized political environment. And that's why I ask, how can this get done? It seems that the public is supportive. We've got quite a few states that have expanded Medicaid, and fairly conservative states, and we've seen some good outcomes from that. Representative Haswood, thoughts on that? You were sitting on that committee. How do we get that done moving forward? Is this something that has to wait until after the 2022 election, or?
Yeah, I talked to my colleagues because at one point during the session I was like, why are we not expanding Medicaid? What good evidence-based factual reason why are we not utilizing this federal dollars that's allocated to this? To my understanding, we pay it on our federal taxes, and that Medicaid, Medicare, it's going to different states that have it expanded. And I talked to some of my colleagues on Health and Human Services that are more on the conservative side, and their biggest concern was they would really like to know the budget plan of the funding. Okay, we're going to have all this funding. I see this, with my colleagues on the other side of the aisle. They would really like to have, okay, we have a big pot of funding coming. Where exactly is it going to go, so we can keep accountability of making sure that every single one of our tax dollars that we all want to make sure that our tax dollars go to the correct places to be utilized. I think it's a fair point where maybe we need to sit down and maybe detail more of Medicaid expansion. Maybe that is something that we need to do maybe on the Democratic side. I've also heard criticism that maybe we have these big ideas, but we don't have the detailed plan that maybe a business mind or economic financial person come from with an accounting background. I've heard that criticism too. I think our leadership could come together, and the governors, everyone can come together and maybe put something together. Maybe I'm just being naive as a freshman that we could work together on a very important issue. Because when you look at it, we're missing out on millions and millions of dollars. And
hundreds of millions of dollars that could be circulating into the Kansas economy. It's not just healthcare that this would affect. Governor Kelly floated a proposal of combining medical marijuana and Medicaid expansion. That didn't get very far.
No.
But that's a potential idea out there in terms of funding. Is that where some Republicans can come around on this, is to have a detailed fiscal plan about the rough estimate, 51 million?
So I'm about to jump out of my seat right now. That has been provided. Through the years, that has been provided, where the savings would be, how it would pay for itself, with the added benefit of the dollars that have been put towards the states just recently by the Biden administration. There's 12 states left that have not expanded Medicaid.
There's further federal sweeteners in the stimulus is what
Right.
we're talking about.
Right.
Makes it even more attractive to
Makes
expand
it,
Medicaid.
that would pay the matching 10% that we would be responsible for, and that's to the tune of I think I recently read 380 million. So that's besides the 90%. It would help us pay that match for, it's estimated 10 years. But to your point, they've had the line item of how it would pay for itself through the years. It's just that the goalposts are moved every year as to why they would want to oppose the bill. And basically it falls to politics. And
what is the politics and what is the rationale? It's sort of hard for me to understand because there's not a specific special interest group that's going to benefit from this, is there? Or am I missing that? I mean, what's the rationale in terms of the resistance?
It's Obamacare. It's connected to the Obama administration, and there are Republicans that feel like expanding Medicaid is Obamacare, which they're not synonymous, but there are people who don't understand health issues that see it that way. There was the reasoning for several years that the states who had expanded were upside down in it. There were years that we heard that the Republicans were going to take over Congress and that they would have their own health plan. Well, we saw that didn't happen. So, my response always was, show me a better plan. Show me a better plan that has the funding with it. And we just haven't seen one. And to your point, that there is a large percentage of the population that support Medicaid expansion, but they don't vote that way. Those aren't the people that they're sending to the legislature. So we became much more conservative in this last election as far as I shouldn't say conservative because I think it's a conservative idea to expand, but that are further right in the political
Can I ask your quick thoughts on that? Why is that the case? Does this have a lot to do with national politics?
Yeah,
and
I think
polarization?
it does. Well, I think it does, the polarization, and I do think that I think that people felt comfortable with electing a Democratic president as long as we had all the checks and balances there. That's completely a theory on my part, but yeah, we did, and we had members from the House who, which by the way, we did pass on the House side 2 years ago, and then we had a bill sitting over in the Senate, and it was just like it was going to be a done deal, but the Senate blocked it from happening.
And I think that was the last time you were on the show, is when that was actually going down. Representative Haswood, on that point that Representative Concannon makes, that this is all politics, that this is really the reason for the resistance of Medicaid expansion. Do you see it the same way? Your thoughts on that? I mean, do we need to retire the Obamacare name and go back to just Affordable Care Act, or?
It's interesting, the Obamacare name, because on paper, to be correct, it's the Affordable Care Act, and I have heard it too in committee saying people use the language Obamacare. I'm like, he has been not in office for quite a while. Why are we still using his name for Kansas politics? So definitely, I think politics does play a part in it. I think it's also been polarized at the federal level from the previous administration. And, I would agree, if you believe in expanding Medicaid, then you should definitely elect officials who believe in that belief, because again, the Senate side is a lot more conservative than the House side, and a lot of bills do get blocked from that end. So I see that in my Health and Human Services Committee, but I'm still, going to make the due diligence to have those conversations and make sure that we try and find at least a conversation or getting this going, because a lot of times, even the PEEP, if I say Medicaid expansion, I get, someone will be like, no, no, that's not how we do it. And then they start making health plans for rural Kansas. I'm like, wouldn't Medicaid expansion assist in this? So why are we making a whole, sometimes I ask these questions, and, I'm learning as a freshman that these are.
And that'd be the number one thing to help mental health.
Yeah.
We had a mental health tour a few years ago, and the one thing that we heard every place we stopped is that please expand Medicaid. And but we still have people who are real strong, as in the chair of the Health and Human Services Committee, very strong on mental health, but she opposes Medicaid expansion. But,
Let's, can we sneak a caller in? You want to make one more point?
Well, can I make one more point while we're on that rural health?
Please.
Rural hospitals. We did pass a bill this year that helps rural hospitals to transition, in real small hospitals, to transition to a freestanding emergency room facility the bill actually then allows for the federal funding of that. But they have to be a critical access hospital at this time in order to be able to transition into that.
Yeah, I saw that detail there.
Yeah.
Let's get a caller in here. Mike from Hayes. Good evening, Mike. What is your question?
Well, there's been discussing expanding Medicare, and I was just still wondering, I know that there's, strings attached, so to speak, with government money, particularly with grants, but it seems like there's a lot of money involved in this, like I think you mentioned about $300 million. Why can't the state take a portion of that money and invest it in a safe account or earning some kind of interest that would help pay the state's costs for the program in the future?
Good question there, Mike. The $350 million is about the estimate what the federal government would provide, if I'm not mistaken. You might probably know more about that than I do. And then the state buy-in would be about $50 million. Is that correct?
Well, it's the fiscal note on that once upon a time was $36 million. Okay. That would be the 10% for 1 year match. And I'm not sure I heard everything correctly. Was he asking about why don't we invest the money?
Yeah, I think if I'm not mistaken, Mike, and if you're still there, you can correct me, taking the state's obligation, the 10% obligation that the state's required, and setting aside that money in a fund where it can accrue interest and pay for it that way?
And if we could, we've talked about such a thing, if we could develop our own health plan, but the issue is that we already pay for this at the federal level. We are paying federal income tax. Before the Affordable Care Act, I won't call it Obamacare, before the Affordable Care Act, the hospitals received money directly. That was called DISH payments, and they received money directly for the uncompensated care that they were that happened at their facilities. And so with the development of the Affordable Care Act, then that no longer happened directly to the hospitals, and then it was assumed every state would expand Medicaid. So those dollars then went to the state level to be dispersed as Medicaid payments for the underserved. And so anyway, that's why we're still losing a lot of money that we're sending out of the state, and we're funding Medicaid expansion in other states.
Let's slide into another issue very quickly. I do want to get to taxes, but I want your opinion on this one. Recreational marijuana, which has been discussed a lot and has been implemented in a lot of states now. I think one estimate said that 2/3 of Americans now live in a state that has recreational. We've seen some conservative states implement it as well. The Kansas Speak survey, fall 2020, the Docking Institute, 66.9% of respondents strongly supported or somewhat supported legalizing recreational marijuana. I was very surprised by that number, 66.9%. Is it time to seriously consider this issue? Representative Concanon, you first.
I don't want to go first. It depends on which day you talk to me, how I feel about this. I do know that it's a wide spectrum of people politically who support it or oppose it. Mm-hmm. I will talk to medical friends who feel like in other states it's been harmful in a lot of ways, both in both medically and in financial ways. But then I think, okay, we could be clearing out some prison space this way. We could be collecting some tax dollars on it. Why are we not doing this? So I know that I probably lose the argument both ways.
Mm-hmm. A medical marijuana, thoughts on that?
Medical marijuana, I'm more supportive of, although if we're going to do it, we might as well do it. Mm-hmm. Go all the way, because it would be the process would be abused mm-hmm. to the point that it would become recreational. In my mind, so if we're going to do it, we should just do it.
Representative Haswood, thoughts on that? Recreational marijuana, strong majority support in Kansas. Surprised by the number. Thoughts on recreational marijuana and medical marijuana?
I'm a big supporter of recreational cannabis. Me and a couple of my colleagues, Representative Shue, Representative Parker, Representative Vaughn, Representative Woodward, we introduced a bill, the Kansas Cannabis Legalization Act. And this was, when I was working with the revisor on this, I did not realize that this hasn't been done in Kansas. So we pretty much have to start from scratch, and we modeled our legislation off of Colorado's legalization. I think now with the conversation of medical cannabis, marijuana coming into the House Fed and State, it really opened up our eyes to make some edits to our bill. But it was really interesting to see that conversation had. I really think it would be great for our state as an agricultural state, where we could add in another good, and it would also bring in another field. It would bring more jobs. It would bring more young Kansans and stay in Kansas, because I know it's an exciting field for people maybe my age, the millennials, the Gen Zs. This is a really exciting field, and I think Kansas has an opportunity to be maybe one of the top leaders. We already have some sort of legalization, medical, around our states, and I think we're losing out on that type of economic profit. But I think, our big ag schools like K-State and our other rural colleges would also benefit. We would have attraction. Maybe college enrollment might go up. This is an exciting field that I think Kansas be such a great leader in.
See, she sold me.
Okay. We'll ask you tomorrow, then.
Ask me tomorrow.
We've got only a couple of minutes, but I want to talk taxes, because we had a CRE revenue estimate, which was a higher, and some good news there. We had a tax bill that was vetoed by Kelly, an alternative that was brought. And there's a lot of detail here, and we don't have a lot of time, but your basic viewpoint about where we are right now with revenue coming in, tax cuts in the future, what those tax cuts should look like. Representative Concanon, your thoughts first?
Well, I voted for the tax bill, knowing that the fiscal note was pretty high, that we would be it would be about $400 million, and so the latest the CRE report that came out made me feel a little bit better about voting for the
yes vote?
The yes vote then, and voting for an override.
That was at $361 million in higher revenues than the previous estimate.
Yes, yeah, and then yesterday I was in Topeka for the CanCare Oversight Committee meeting, and we had the caseloads estimate presented to us, which those are all the entitlement programs, and those numbers were reduced. So all in all, a very good report.
Representative Haswood, thoughts on tax situation, revenue? Kelly vetoed, potential veto override, I think is likely on this one. What were your thoughts? Did you support that tax bill in the legislature, and what alternatives, if not?
The things with taxes that in the budget and all this, one of my biggest concerns was public school funding wasn't in the budget with tax revenue. Looking at, this is a hard economic year for Kansas, for Kansans. And a phrase I always hear in the State House is, How can don't touch my taxes, and how do we cut taxes for Kansans? And I get it. We want to have people save money, but we also, I look at issues like in health where maybe we took the cheaper option, and it really, maybe with our hate all unemployment, we took the cheaper option of not investing, and how detrimental if we don't, really invest in our infrastructure as a state, and making sure that taxes and this, what comes to my mind is like the food sales tax, and I know there was an attempt to reduce it, but I also believe that we should eliminate the regressive tax. I think the legislature was put in a really tough spot this year with the economic and the shortfall of the budget. That I can't even think of any better way that our economics could have been that made more Kansans happy of the decisions that were happening.
Yeah, and it seems like there might be a little bit of a race here between a Kelly alternative, Governor Kelly alternative, and the veto override, because it looks like they have enough votes for the veto override, but Kelly wants to present some kind of alternative to maybe appeal to those moderate Republicans. We'll see how that showdown goes down. And that is it for this evening.
Oh my gosh.
Well, we covered a lot, and it went by pretty fast, but another excellent show here on the Kansas Legislature. I'm Jay Steinmetz. Thank you very much, Representative Concanon and Representative Haswood. Good evening, and we'll see you next time. So long.
Sunflower Electric Power Corporation, cooperative members working together to generate power so you can enjoy the benefits of life in central and western Kansas. Sunflower Electric Power Corporation, energy done right.